The following educational video was created in collaboration with the Transfusion Department of the General University Hospital in Prague and the Faculty of Biomedical Engineering. A transfusion is the transfer of human blood or its components obtained from a donor to a recipient. A blood transfusion can be considered a specific case of organ transplantation. An autologous transfusion comes from the recipient's own blood. An allogeneic transfusion uses blood components from human donors. Blood groups represent a way to classify blood based on the presence or absence of specific antigens on the surface of red blood cells. These antigens can trigger an immune response if recognized as foreign. There are several blood group systems, but the most well-known and important are the ABO system and RH system. Indication and ordering of blood products. A physician indicates a transfusion based on the results of a blood count and the patient's clinical condition. The order must be made in writing in the patient's medical records, specifying the type of blood product, number of units, and urgency. The order is confirmed with a timestamp and the physician's signature. The physician must inform the patient of the planned procedure and obtain a signed informed consent. After obtaining consent, request forms and blood collection tubes are prepared. The request for a transfusion product and basic immunohematological testing must be accurate and complete. The request must contain patient identification information, phone number, name of the nurse collecting the sample, name of the ordering physician, transfusion history if known, Some departments also prepare a requisition form clearly indicating the quantity of transfusion products ordered. A separate request form and release form must be completed for each type of blood product. A blood sample for immunohematological testing is collected by venipuncture into a pre-labeled test tube, which must be filled with at least 6 milliliters of blood. Only if vein access is not possible may blood be drawn from a catheter or cannula, but only at least 1 hour after the last medication or infusion, and the first tube is discarded and not sent to the lab. Misidentifying the patient during blood collection can lead to fatal consequences such as acute or delayed hemolytic reactions. Therefore, it is essential to verify the patient's identity by matching the ID on the tube label and the request form. The healthcare worker is responsible for the correct collection, labeling, and identification. A blood sample must be sent with every request for red cell products, even if multiple requests are made in one day. It is not necessary for platelets or plasma, provided the recipient's blood group has already been determined and verified in the lab. Together with another qualified staff member at the patient's bedside, a double check of all identification details is performed in medical records, on the sample tube label and on the request form, including checking that the collection was performed on the correct patient according to the ID data on the identification bracelet before sending the samples to the FTO. This double check must be confirmed with full identification in the medical documentation. Tubes and request forms are placed in a plastic bag and sent, e.g., via pneumatic tube, to the blood bank laboratory. The transfusion lab receives the request, verifies patient ID on the tube and form, checks urgency, and logs the time of receipt. The request is entered into the blood bank's information system. If the patient's blood group hasn't been tested in the lab before, a preliminary blood group test is performed using diagnostic sera, anti-A, anti-B, and anti-D. Based on the results, a compatible blood product, ABO and RHD, is selected from the blood bank inventory. The selected blood product is then logged into the system. Blood samples undergo centrifugation to separate serum. Transfusion product samples are prepared for testing, and patient and product IDs are checked prior to analysis, along with the requested tests in the system. Samples are analyzed in an automated analyzer, which reads and confirms the test results. Pre-transfusion tests include determining the patient's blood group, verifying the blood group of the transfusion product, screening for irregular anti-erythrocyte antibodies, compatibility testing, finally, compatible blood products with the test results are prepared for dispatch from the blood bank. Blood products are released from the blood bank based on a completed requisition form. It must contain complete patient ID, type and number of products requested, phone contact, the department stamp, the name, and the doctor's signature. Before release, the blood bank staff verifies appearance of the blood product, product number, blood group compatibility, test results, validity of compatibility testing, expiration date. The accompanying documentation includes delivery note, adhesive transfusion record label, pre-transfusion test results, the orderly signs for receipt of the product. Transfusion products are transported in disinfectable, temperature-stable containers. Upon arrival at the department, the transfusion product and documentation are checked at the patient's bedside. The physician performs a blood group compatibility check, Sangvi test, using blood from the transfusion product and the recipient. Sangvi test procedure. On a pre-printed Eldon card, 1 drop of blood from the patient's finger and 1 drop from the blood product are placed. Both cards have designated areas where the blood is mixed with reagents containing anti-A or anti-B antibodies. The physician observes whether agglutination, clumping occurs in the individual fields on the cards and verifies that the patient's blood type and the blood type of the transfusion product are compatible within the ABO system. The physician is responsible for verifying all necessary details before administering the transfusion. All healthcare workers who handled the product immediately before administration, including those who performed the Sangvi test, must sign the patient's medical documentation with full identification. In adults, transfusions are usually administered via a peripheral venous catheter of 18 gauge. The minimum recommended size is 22 gauge. Transfusions may also be administered through the distal lumen of a central venous catheter. The rate of administration of transfusion products is expressed in milliliters per minute, milliliters per hour, or drops per minute. The volume of 1 milliliter of transfusion product corresponds to approximately 15 drops. Red blood cells are administered at a rate of 2 to 6 milliliters per minute. That's 1 to 2 hours per unit. We administer platelets and plasma at a rate of 4 to 10 milliliters per minute. That's 15 to 60 minutes per unit. Speed depends on the volume and patient condition. Start transfusion as soon as possible after receiving the product. For red cells, platelets, or thawed plasma, the transfusion must be completed within 4 hours of release from the blood bank. It is recommended that transfusion begin within 30 minutes of release. Until administration, blood products must be stored at 20-24 degrees Celsius. After the transfusion begins, the patient remains under the direct supervision of a physician or competent non-physician for the first 15 minutes, with the possibility of immediate availability of a physician in case of complications. The preparation is administered very slowly at this stage, 1 to 2 milliliters per minute, which is approximately 15 to 30 drops per minute. If there are no signs of an adverse reaction, the transfusion continues at an appropriate rate. This applies to each unit of the transfusion product. During the transfusion, the patient is monitored at 30-minute intervals. These checks are recorded immediately in the documentation. The patient is provided with a signaling device and instructed to report any new symptoms immediately. If any symptoms occur, the transfusion is stopped and a doctor is called to determine the next steps. The transfusion is ended when approximately 10 to 15 milliliters of the product remain in the bag and the line is clamped. If intravenous access needs to be maintained, the line is flushed with 20 milliliters of saline using the start-stop method. After the transfusion set is sealed, protected against contamination, and stored in a refrigerator at 2 to 6 degrees Celsius in a separate labeled compartment designated for biological material for a period of 24 hours. The values of the patient's vital signs after completion are recorded in the documentation. OŠETČOVATELSKÉ